All right, so something I want to talk about today is the idea or discussion around repeating orthobiologic injections. Whether that's prolotherapy, PRP, anything else. Repeating them, how many treatments might somebody need? Will the treatment effects wear off? All these different types of things. So first and foremost, we have to step back to try to understand what we are trying to accomplish with these injections. And what we are trying to do is we are trying to help the body to resolve an old injury. Now, sometimes we get that and sometimes we don't. There is a failure rate and some people just don't respond well. And there's a litany of reasons for that, which we'll cover in later videos. But our goal is to help the body resolve an old injury. Our goal is to not suppress pain. Our goal is not to suppress inflammation. Our goal is not to surgically reattach anything because this isn't surgery. These are percutaneous, which basically means we're using an injection to achieve that effect. And so with that being said, there's not going to be necessarily a wearing off effect for the most part. Now, sometimes when we do our injections, the inject date. So for example, we commonly see this if we use adipose tissue where patients will get an anti-inflammatory effect from the injection. And that can be because some of the cells or even sometimes the platelets can exert an anti-inflammatory effect that is temporary, and that part goes away. Okay, so sometimes we see that in the initial stages, like the first week or two after an injection, patients might get insanely better, then that wears off at about the 1 to 2 week mark, and then the healing happens after that. That can happen, but that's not really what we're talking about here. We're talking about after the healing has happened. So if we get healing, if we actually stimulate and trigger the body to go through a healing response, the effects of that are not necessarily going to wear off. And can you revert back to your original state? Yes, of course you can, and we're going to talk about some of those reasons. But it's not that the injections wear off in the sense like when you get a steroid injection, the steroid exerts an effect, and then after a period of time, that effect wears off. That's very, very different. And I think that's maybe why a lot of people ask this question about like, oh, do the PRP injections wear off? Because I think they've kind of been conditioned with lidocaine injections or anesthetic injections and the steroid injections, because in those things, they do wear off. So with that, now, one of the potential reasons why we might have regression of symptoms is for multiple reasons. So the first is the aging process. We are all aging, we are all getting older, and the rate of aging is going to be different depending on what stage of life you are in. If you are in your 20s, that rate of aging is going to be very, very, very different than somebody in their 70s or their 80s. In the sense that in your 70s and 80s, your rate of aging is accelerated compared to when you are younger, in your 20s, 30s, 40s, 50s. There's even a big difference between being in your 60s versus being in your 70s and 80s. And so if we treat something that has a degenerative component to it, so as an example, knee osteoarthritis, let's say it's moderate, it's grade 2, maybe grade 3 osteoarthritis, so it's in our mild to moderate type range, and we see improvements over a period of time, let's say 2 years. But then the symptoms start to regress a little bit. That's not necessarily the injections wearing off. That's actually just that we are seeing progression of the disease because it is a disease of aging. Now, there might be some molecular biophysiological components that we don't fully understand, and maybe there is a bit of a wearing off effect from whatever was injected in and the changes in the inflammatory milieu that we have in the synovial fluid in patients with osteoarthritis. Maybe there's a bit of that, but I think that is beside the point, because I think what patients are really asking for on does this wear off? They're asking, if I do this, will this just come right back if I don't do anything? Will it just come right back and I'll have to do this again? And really, no. But yes, again, it depends on what we're treating, depends on the state of health, it depends on the aging and age and everything like that. So the state of health is also something else that we have to consider, because if somebody is highly inflammatory, so they've got excessive levels of inflammation that we are able to test for on labs, and they have conditions that make it more difficult to heal, something like type 2 diabetes or even uncontrolled type 1 diabetes, then we might get into a state where we might see the effects of an injection not last as long as they should, or not be as strong as they should be, because of the human and the cells are not healing the way that they should. And so that's something else that we can see. So that being said, on the other reason that we can sometimes see regression is new injuries. So I had a back injury. I herniated a disc. That disc resorbed. It went back in on its own with some just conservative care, physical therapy, chiropractic, massage, things like that. But then I had long-standing chronic pain afterwards that was later diagnosed as an iliolumbar ligament injury that I then had treated with PRP initially, and then subsequently I had a bone marrow concentrate treatment. And today I will call pain-free. Maybe 1 to 2 days a month, I get a low grade, like I'm talking a 1 out of 10, ache in my back if I have been standing for a long period of time, or if certain things have happened, something little happened in the gym or whatever. But for the most part, I'm pain-free. Now, if I do something and I injure my back, that area is most likely going to be what I injure again, because that area is susceptible to injury because I've already injured it. And so anytime anything heals, whether that is from naturally from an injury, or when we get a healing response from the regenerative injections, we never see 100% healing. Unless you're a toddler, unless you're a little kid who just, your stem cells are so gangster, it's crazy, we're not going to see perfect healing. So because of that, we have a little bit of change, and that change makes us more susceptible to injuries in the future. That's why if you roll your ankle once, you're more than likely going to roll it again. If you dislocate your patella, you're more than likely to dislocate that again. And so for me, if that happens, it's not that my previous treatments wore off. It's not that the bone marrow concentrate or the PRP treatments that I have worn off and now all of a sudden I have pain in my back. No, it's that I injured it in the past, and that is going to be a weakened area for me. And so I have to make sure that I take care of it. So that's one of the other ways that pain can come back. Now, the last thing to talk about is number of treatments. So what I have learned from experience is that this is always going to be individualized. There are certain trends that we can see, especially when we're dealing with our proliferative injections, so our dextrose prolotherapy, our platelet-rich plasma, our bone marrow concentrate, or our adipose tissue. What we see is that as you go up in strength, the number of treatments generally required in order to provide the long-lasting relief patients are looking for generally goes down. Outside of that, it is really, really difficult to predict how many injections some people will need. Some people, I might in my head think that, they're probably going to need 2 or 3 treatments. And we do one platelet-rich plasma treatment and they're 90% better and we don't have to do anything else. There are other patients who I think, oh, this is a slam dunk. There's probably just going to be 1 injection, and it turns into 2 or 3 because they didn't have the initial response that we were hoping for. And so it's really difficult, and that's why we don't sell injection packages, because we need to individualize each and every one of these. Because sometimes we start with, let's say, prolotherapy, and we only get a 30% improvement in pain after 1 treatment. And so financially, it makes more sense to actually step up into a platelet-rich plasma injection. And so there's lots of nuances in this approach, and that's why we don't sell packages, because the number of treatments that somebody needs is going to be individual and it's going to be varied. We have ballpark ranges, but again, it's always going to be individualized, and that's what I'm always stressing with people. All right, everybody, I hope you all learned something today. I'm going to go throw this ball with Groot, and I will see you later.